A new study shows college students are reporting lower rates of depression, anxiety, and suicidal thoughts. Experts say more students are accessing the mental health resources available to them. Dr. Daniel Eisenberg is from UCLA Fielding School of Public Health. He's one of the investigators on this study, and he's joining us now to talk about these findings. Thank you so much for being with us.
Thanks for having me.
It is very positive to hear good news when it comes to looking into the mental health of young people. So were you surprised to find that things had improved with young people when you did this study?
Well, we've now seen it for a few years in a row, so I think it's a real trend that's happening, and with the with distance from the pandemic, and then all the efforts that college universities have been doing to support students better, I think it makes sense.
Yeah, it sounds like it's actually working. So improvements for the last 3 years, I understand. What were some of the other key findings of this study?
Well, so we look at a variety of measures related to mental health, like depression, anxiety, suicidal thoughts, substance use, and loneliness. And all these things are going in the right direction. They all seem to be improving.
Yeah, we understand that students are accessing digital and mobile health resources available to them. Talk about some of the things that you think are helping the most drive this trend in the right direction.
Yeah, and that's maybe sort of part of the silver lining of the pandemic, is that there was more flexibility in how we offer resources, especially technological resources. And so one example at UCLA is my colleagues developed a program called STAND it's a screening for treatment in anxiety and depression. And the idea is to sort of match students to the right level of resources. So students with mild symptoms maybe get self-help digitally, and students with higher levels of symptoms will get more intensive traditional therapy.
Nice. So you kind of cater it to what each student needs. Now, even with these positive improvements, we still talk about depression, anxiety, loneliness with young people a lot. More than half of the students in this survey still said that they felt lonely, which we know loneliness has been named an epidemic even by our past Surgeon General. So tell us more about that part. How do you continue to improve things that are improving but still really bad?
Yeah, I think when we think about mental health, we often think about therapy and medication, but also more social factors can really help people. And so if we can address loneliness more effectively, whether it's college or elsewhere, that's going to be good. And a lot of college universities are trying to do that in a variety of ways through their residential life, or through engaging students more academically, or peer support, for example.
And you mentioned the pandemic, that was one factor, but we also talk about societal factors with young people that have changed, how communities have changed, being on technology more. How do you change some of those things that really are systemic throughout all of society to help these students?
Yeah, well, I think maybe part of the positive trends that we're seeing also is that perhaps young people and the people who are supporting them are getting better at sort of healthy behaviors with digital and social media, because that was one of the leading explanations for why there's such a rise in distress. And now I think there's more appreciation for how we need to be healthier in how we consume digital media, especially for younger people.
Absolutely. That awareness helps, because then you can change those patterns that are leading to this. Okay, so colleges and universities, though, are limited when it comes to funding for mental health services. As a researcher, what can be most beneficial for students who are still struggling in these areas?
Yeah, well, a lot of the things we can do to help students don't necessarily have to cost a lot of money.
Okay.
So we do need to hire more counselors and more psychiatrists and so on. And that costs money, but things like finding ways for students to engage more academically or with each other, or have a greater sense of belonging, maybe a lower loneliness on campus. Those are things that don't necessarily require a lot of resources.
Interesting. Okay, well, this is all very important, and I'm sure helpful to students and to parents as kids navigate this college landscape. But I think it's positive, again, that you guys are seeing things improve every single year. All right, Dr. Eisenberg, thank you so much for being with us to talk about the findings of this study.
Thanks.